आपने अक्सर लोगों को कहते हुए सुना होगा कि अगर वक्त रहते पता चल जाता तो इस बीमारी का इलाज हो सकता था, लेकिन ज्यादातर मामलों में बहुत देर हो जाती है और यही देरी बहुत से लोगों की जान जाने का कारण बनती है। सवाल यह है कि अब इलाज क्या है? इलाज डिजिटल हेल्थ के जरिए ढूंढा जा रहा है और बहुत सारे देशों में इस पे काफी आगे तक काम हो भी चुका है। मैं इन दिनों हंगरी की राजधानी बुडापेस्ट में हूं और यहां मैंने मुलाकात की एक ऐसे ही डिजिटल हेल्थ एक्सपर्ट से जो हमें बता रहे हैं कि अगर हम डिजिटल हेल्थ मॉनिटरिंग या डिजिटल हेल्थ के अलग अलग एस्पेक्ट्स का सही तरह से इस्तेमाल करें तो हम आने वाली बीमारियों के बारे में वक्त से पहले जान सकते हैं, यानी प्रिडिक्शन हो सकता है, यानी डायग्नोसिस सही टाइम पर हो सकता है, यानी डॉक्टर को ज्यादा वक्त मिल सकता है जिससे कि जो मरीज है उसकी जान बचाई जा सके। और ज्यादातर मामलों में तो ये होता है कि हमें पता ही नहीं होता कि हम किसी बीमारी से जूझ भी रहे हैं। खासकर ऐसा मेंटल इश्यूज में भी होता है, मेंटल हेल्थ इश्यूज में भी पता नहीं चलता और बहुत देर बाद जब सब कुछ सामने आता है तब तक बहुत देर हो चुकी होती है। इस वीडियो में मैं आपको अपनी बातचीत का एक खास हिस्सा दिखाने जा रहा हूं और मैं खुद चाहता हूं कि आप लोग भी डिजिटल हेल्थ के बारे में अवेयरनेस क्रिएट करें, उसके बारे में पढ़ें, जानें और बात करें। राइट डायग्नोसिस एट द राइट टाइम कैन सेव मिलियंस ऑफ द लाइव्स across the planet, but unfortunately that doesn't happen all the time. And what is the solution for this? There is one solution for this big issue, which we call digital health. Now, what is this digital health? I have someone who is contributing to this digital health and who has got extensive knowledge and research. We have Dr. Zoltan with us. Doctor, welcome to the show. I would want you to, tell my audience what is digital health and how we can get the most of the benefits out of it.
Okay, hello. We have entered a new age.
Yeah.
This can be called the data age because we have a large footprint and a digital twin. We all have digital twins in somewhere in the cloud. And when we analyze these digital twins, we can understand our organisms, our behavior, our connections much earlier, much easier. So digital health has the ability to provide earlier diagnosis, earlier sign of diseases or earlier sign of illnesses and can provide a better support to everyday life. So we all use navigation systems
Yes.
when we want to orientate ourselves in the traffic.
So it's like having your doctor all the time, like.
Yes.
So do you think if someone wants to career in digital health, are there any provisions, options available currently, because now digital is getting into trend?
Yes, digital health is all about personalization. It's a personalization of disease treatment and diagnosis, and we need to analyze large set of data. So data science is very important, and different type of data aggregation. So data scientists, data analysts, IT security specialists are all welcome to in this scene, because we need to handle these data securely. We need to process all these data, and we need to develop artificial intelligence. So we need to use deep learning capabilities and machine learning capabilities. So at the end, we want to develop predictive algorithms.
So if we talk about mental health issues, which is like, just become very common post-COVID situation, do you think that we can also monitor some behavioral changes in someone and, we can predict at the right time that this guy is facing some issues, this might happen to this person?
Of course, in mental health issues, our behavior is changing slowly but dramatically.
Yeah.
So any footprint of our pattern can provide us very good signs of the changes. We know that, for example, when Facebook analyzes our posts and pictures, what we post every day, it can be predictable for any mental diseases and for movements and our moving behavior or speaking behavior is changing as well. So yes, our digital footprint gives a lot of information about mental health.
So how does we monitor, like we know about smartwatches and all, like how do we monitor everything what is changing within us?
We need to collect a large set of data, and yes, smartwatch, mobile phone is a very good source of data. We have wearable devices, more and more wearable devices, but we have home measurement devices. We have smart homes, more and more smart homes, and we have the clinical data, biomarker data, genetic data. We put all these data together, and we are able to understand the function of our organisms much better.
And what do you think? What is the potential, like future, and especially in countries like India?
India is in a very good position because we need large data set for the analysis. And if you just consider India with 1 billion inhabitants, these inhabitants provide a very good large data set for the analysis, and all the data scientists can learn about those data sets. In Europe, it's much more difficult because there are several countries, and the countries need to agree on data, cross-border changes, but in one country it's much easier to handle.
So does it have any side effects, like if I am all the time, just monitoring what is my heartbeat, what is my blood pressure, or whatever, what are like, changes I'm seeing in my body, does it have any kind of side effects also?
Everything has side effects.
Yeah.
So you can become an addict of those measurements. So balance is always important, and so we tend to say that human-machine interactions and human-machine collaboration is important. So machines and robots won't solve these issues. We need to collaborate with each other and with the robots, with the algorithms. So human-machine collaboration is important.
So if someone has to read those algorithms, it has to be monthly, weekly, or fortnightly? What do you suggest? Like, because all the time if we are monitoring, there has to be some time when we are, just comparing this month with last month, with this week with last week.
For example, data about our sleep quality can be important every morning. My blood pressure can be important every week. Our mental health can be important weekly or bi-weekly. So it's depend on the function what we want to monitor.
One last question: if someone wants to make a career and they would want to study what digital health is, and if they would pursue some degree courses, do you suggest some universities, some institutions where one can make the career?
Yes, there are lots of very good institutes and universities. Semmelweis University, when I am head of the department of virtual health guide methodologies, is concentrating on that very issue, and we built up the institute around this topic, and we collect all the knowledges. So it's a hub of knowledges from data scientists, from medical scientists, and from social scientists.
Dr. Zoltan, this topic, this subject is really new for Indian audience. I'm really grateful that you have shared a valuable information. I would want to invite you to India, and where we can, on a one-on-one basis, we can interact with you. Thank you. Thank you
very much.
तो मेरे इस इंटरव्यू में आपने देखा कि कैसे हंगरी की राजधानी बुडापेस्ट की एक यूनिवर्सिटी में काम करने वाले प्रोफेसर डॉक्टर ज़ोल्टन लेंटोस हमें बता रहे थे कि कैसे डिजिटल हेल्थ के जरिए हम बहुत सी ऐसी बीमारियों से लड़ सकते हैं जिनके बारे में हमें बहुत बाद में पता चलता है, और जब तक पता चलता है तब तक कई मामलों में मौत हमारे सामने खड़ी होती है। तो डिजिटल हेल्थ एक ऐसा क्षेत्र है, मैं कहूँगा, जिसमें अब रोजगार के अवसर भी हैं, जिसमें अब पढ़ाई के अवसर भी हैं, और मैं चाहूँगा कि जो लोग मेडिकल फील्ड में इंटरेस्ट रखते हैं, बिग डेटा साइंस में इंटरेस्ट रखते हैं, टेक्नोलॉजी में इंटरेस्ट रखते हैं और डिजिटली अपनी हेल्थ को बेहतर बनाने में जिन्हें इंटरेस्ट है, वो इसमें अपना करियर भी ढूंढ सकते हैं।